How's it going, everyone? Good to be back. Last video I tried to cover topics that I thought were important in regards to pain, and today I would like to talk about ways that we can go about treating that pain. So to recap from my last video, I talked about how the body and the brain senses pain, and what happens is your body feels some sort of stimulus, usually stimulating those A delta fibers and C fibers, and those send messages of your peripheral nervous system to your spinal cord, up to your brain, and then your brain sends a message back down that is the feeling of pain. All right, and today, one of the ways that manual therapists, athletic trainers, PTs, chiros, you name it, anyone who uses manual therapy on a daily basis, manual therapies are ways that you can influence the brain and the nervous system in a way to override that pain system. And that is done by stimulating A beta fibers. Now, most of the A beta fibers and mechanoreceptors are stimulated by some sort of touch, vibration, pressure, that sort of thing. And so if you think about all of the tools that we typically use, a lot of them are really only operating at a skin level, but that's totally okay, because in order to get those A beta fibers working and hopefully overriding those A delta fibers and C fibers, you have to be able to touch the skin. And the reason why this works is those A delta fibers and those C fibers are actually, rough eyeball just for demonstration, let's say, they're this big around. Well, those A beta fibers are actually bigger, meaning that they can send messages faster. And so if you can stimulate the A beta fibers, that message gets sent up to the brain faster than the pain signal. So you can essentially use touch as a way to override that pain system. And there's all sorts of things that you can use. I'm thinking of all the things that athletic trainers traditionally have used in the past. Someone gets injured, you have your classic RICE method: rest, ice, compression, elevation, and all that's good. It works. It stimulates things in a way that can take away pain. You have electrical stimulation, therapeutic ultrasound, massage, self-myofascial release, and now, what's come up to be a lot more common is instrument-assisted soft tissue massage, cupping, dry needling, the use of kinesiology tape, and there's so many other things out there that I can talk about. But bottom line, all those tools are ways to influence the skin and give that something else to feel, stimulating those A beta fibers to give the body something else to feel other than pain. And so behind me I've got a couple tools that I like using, and I'm hoping in some other videos I'll be able to go into more depth on how to use these tools and why they work. But I'm just going to take a couple out and show you what they are, how they work. A lot of you guys probably already know that, but it is fun to talk about all the different tools that you could possibly use to influence pain. I don't have IASTM units. I don't have ultrasound sitting around. I have ice in my freezer, but I'm not going to bring that out for the purpose of this video. So a lot of these things are just kind of my handheld manual tools that I enjoy using on a daily basis. So the first one that I just recently took a class in this summer, was dry needling. And basically, it's taking small filiform needles and pushing them into muscle, breaking out trigger points, relaxing tissue. And so far, I found that the dry needles definitely get the best results when you're trying to calm down pain and muscle tension. Obviously, you need to take a class for this. You need to make sure that you can legally do this in your state. Make sure you're keeping up on your Practice Act. Make sure you are part of a profession that can do this legally. And then make sure you get education on it. But once you do that, dry needling has been super effective. It's been absolutely awesome for me. The next thing here is kinesiology tape. So I'm a big rock tape fan. I'm not sponsored by them by any means. I don't teach for them or anything, but I do love their products, so I will show a lot of their products on this video. But one of the great things about rock tape is they make the best kinesiology tape, in my opinion. Out of all the ones I've used, rock tape is the best. It's a little bit more expensive, but it stays on the longest, and it's just overall a lot better quality. So what's cool about this is I mentioned earlier about how those A-beta fibers are stimulated by touch. There's a whole bunch of things that people say kinesiology tape does, but for the most part, it's something to put on the skin and give the brain and nervous system something to feel other than pain. So it's really quite simple. I've already got a pre-cut strip here, but as I rip it, I'll kind of show in the camera what it looks like for those of you who haven't messed with kinesiology tape before. But it can stretch a little bit, and when you put that on the skin, depending on how you put it on the skin, it basically just provides a sense of touch and feeling to the body, giving the brain something else to latch onto other than that feeling of pain. So there's tons of different ways to apply it, all sorts of different techniques, and really once you take the class, you kind of play around with techniques that work for you. But I think the bottom line, one of the most effective uses of kinesiology tape is to just give people a way to get out of their pain. It's really good at managing pain. You can correct movement patterns with it and all that, but it's super effective for treating pain, at least in my experience. Next thing, we'll just go over a couple self-myofascial release tools. Obviously, people love, grabbing lacrosse balls or whatever and mashing muscles. It feels good, a little self-massage. All this is basically touch again, right? You're just touching the skin with whatever you're using, and it's giving your brain something else to sense and feel other than pain. All sorts of products out there. Lacrosse ball is something that I use quite a bit. You've got your peanuts, and then you've got foam rollers. This is the Gator roller, and I really like this thing because it's got all these little knobs and notches on it. And so when you think about touch, but then also skin stretch, this foam roller can really, if you want to, get a grip of the skin, and depending on how you move your body on it, you can really stretch that skin and give the brain even more to feel on, other than simply just pressure on the foam roller. But these are definitely effective. Now, I wouldn't say that with all of these you're breaking up scar tissue or muscle tissue, but you're simply innervating the nervous system and giving it something else to feel, and hopefully helping it relax a bit. And this is an effective way to do that. Next thing is the flossbands. Now, flossbands have been around for a decent amount now. You really came out in CrossFit, and Kelly Starrett, in my opinion, was really the one that kind of got these super popular. But Rock Tape makes one, Rock Floss. It's awesome, and basically with this, you can take this and wrap it around different joints, muscles, all that, and because of its ability to stretch and add compression to an area, it's another tool that you can use to eliminate pain. And what's cool about this is you can do it passively. You can wrap it on someone, move it around, or you can have someone move with it on. So it's a pretty awesome tool. One of the things that I particularly love using this thing for is ankle sprains. I remember in undergrad I sprained my ankle in an intramural soccer game, and traditionally, as an athletic trainer, I would have used ice, wrapped on a horseshoe, kept a compression wrap, rested, and that's it, waited for the swelling to go down, and then waiting to eventually strengthen it back up. But I wrapped this floss band around my foot, starting at the bottom of my foot, up my ankle, just to kind of help flush some swelling out, but also just give some compression on it, make it feel safe. And let me tell you, after a couple of days of just wrapping it with this and doing some other exercises for it, it was in a good spot, feeling really good, and got, in my opinion, better results than your traditional ice horseshoe wrap and rest. So, great tool, tons of uses for it. Hoping to show more about this in future videos. On to my massage tools. So I've got all the Rock Tape tools. I've got the took the education courses, got all the tools. This one's the Mohawk. All of them have different edges, which provides different ways to stimulate the skin. You can scan for fascial adhesions and then go in and rub them out. But the cool thing about the Mohawk is it comes with several attachments, and when we're thinking about the A beta fibers, these are just different ways that you can innervate all those. So this red sleeve, you can take it and kind of stretch skin a little bit, which is awesome for relieving some pain, maybe opening up space for nerves to breathe. And then the black comb is just kind of a nice, relaxing feeling. You got that light, sustained touch on your skin, kind of similar to when someone scratches your back. You know, it feels good, it's relaxing, or someone scratches your head. That's kind of the same philosophy behind it. And then they've got the big one. This one's called the mallet, and this is probably my favorite one. It's decently heavy, got a lot of good edges, but it's easy on my hands. And a lot of the guys, a lot of the athletes, patients that I use this on, love this thing. And there's tons of different edges that you can use to just get the body feeling better and hopefully take away pain. And then the last one is the mullet. Now this one's a little bit lighter, so this one I like to use similar to the comb of the Mohawk, where it's just kind of fast, light movements, giving the brain something to grab onto again. And what's cool about this is you can use this to kind of prep movement for corrective exercises or whatever you have planned for them. It's good to stimulate all those A beta fibers and hopefully keep them stimulated through movement, but it works great. I'm not going to say that these rock tape tools are the best tools ever. I mean, you can really use any tools you want, whatever company you support, Graston, Hot Grips, all that. All the tools are basically going to be able to do the same thing. It's just in understanding the concepts of how you can affect the nervous system with it. I mean, you could even use a spoon if you wanted to get effects with that. Next thing I'll go over cupping. So cupping's been something that I would say has come out as decently popular as of late. I just got this kind of traditional set for Christmas, and basically you just take one of the cups, apply it somewhere on the skin, and you can suck that skin up, and so it provides some compression around it, get some skin stretch when it lifts the skin up into the cup. And again, just another thing for the brain to feel on and get those A beta fibers stimulated. Rock tape has their rock pods, which are awesome, and I really like these, especially if I'm doing movement with someone. So they're definitely flexible. Can get some good suction with them. What's cool about these is because they're kind of a rubber material, I can put them on and take someone through movement with them and not worry about them falling off and breaking or something like that. So really like these a lot. But anyways, those are just a couple tools that you can use to kind of manipulate the nervous system and help people out of pain. One thing I will say is that not all these tools are kind of a one-time use, boom, your patient is good. What I'm going to say as a manual therapist and as an athletic trainer that takes people through rehabs and has to get people moving at a high competitive level, these are all great and they work, but in my opinion, you have to couple them with something else. So normally, if I'm working with someone, I'll do some sort of manual therapy treatment on them, and then I'm going to take them through a couple exercises to kind of reprogram their body to move without that pain. So, for instance, somebody sprained their ankle and they're still having pain in a lunge or a squat, I'll wrap that floss band around them a couple times, get that nice compression on it, get the A beta fibers stimulated, get them feeling good, and then immediately after taking it off or keeping it on, take them through that lunge or squat again and see if it's less painful or gets better. So I've heard this saying before. I can't remember who said this first that I was listening to, but I've loved it ever since I heard it. Motion is lotion. So you think about, massage and cupping and instrument-assisted soft tissue massage, all this stuff. It's great, but moving your body is going to be one of the best ways to get your self feeling comfortable moving again without that pain. That was just kind of a rough crash course of a bunch of different tools you can use. There's a bunch of other ones out there that I've missed. And what I will say is, when it comes to the research and what people believe in my opinion, any treatment that is supposed to take away pain is valuable, and it really depends on your patient that you're treating. If you're someone who thinks that ice isn't useful, it's not good for recovery or pain or whatever, that's fine, but there might be some patients who what they need to get out of their pain is a bag of ice. And so really just ask your patients, see what they like, see what they've had good experiences with. Some patients might not have had good experience with instrument-assisted soft tissue work because beforehand when they went to someone scraped the heck out of them, bruised them up, it hurt, and they didn't like it. So you might have to go with other options or re-educate them on what you're actually doing. So what I want to say is, don't knock anything. Everything is useful. There's a time and a place for everything, and use it all. Expand your toolbox. Use as many tools as you possibly can. I feel like the more tools and more options you have for your patients, the better it's going to be for them and for you, because you'll enjoy helping people get out of pain and get back to moving to do what they want to do. Thank you for watching this video. Again, I hope to come out with more specific videos on how I like to use all of these things and tools that I showed you today. And then also I'd like to get into more of the neurological aspect of pain and why the certain ways you use these tools affect the nervous system, especially when it comes to the mechanoreceptors. Thank you for watching, and I'm hoping to come out with more awesome videos.